All right, if you've been on the internet or YouTube looking at chiropractic stuff, then you've had to have seen everyone getting every part of their joints cracked or their heads ripped off.
Oh.
I'm gonna talk and dive deeper into why some of that is a really bad idea for you. I'm Dr. Ryan Hetland, and I've been a chiropractor for 14 years. I've seen a lot, I've heard a lot, patient experiences. Some are good, some are not so good. Probably one of the most popular things on YouTube and kind of known for chiropractors is we crack joints. You hear the crack, you feel the crack. Some people love it, a lot of people love it. Some people hate it, don't want to hear that crack. And that's why there's certain techniques where they don't even get a crack. They might use a clicker, might use a puff of air on your atlas. The most popular is just cracking every joint in your body, just feeling that crack. Now, what that's doing, even when you do your knuckles and you hear that crack, is it's releasing certain things from the joint. So temporarily you get this feeling of relief, but the question is that good for you long term? Should you be adjusting every joint in your body weekly? I don't think so. Now, some might disagree, but I don't think so. I wouldn't do it, and I wouldn't want my spine and every joint in my body cracked all the time. Now, it could create joint arthritis if a joint doesn't need to be adjusted and you're adjusting it. My question is, why are you adjusting it if it really doesn't need to be adjusted? And just because it makes a crack doesn't mean it actually needed to be adjusted. The other interesting part of chiropractic that's popular on YouTube is this towel wrapped around your neck, tug, aggressive pull on your neck, which I think is really barbaric. When I was in chiropractic school, they didn't teach that at all. So I don't know where that's coming from or how no one's gotten in trouble yet. I think it maybe started with a stretch idea, but quickly probably turned into, tug your neck as hard as you possibly can. And that to me is dangerous. That's something I would highly not recommend. I don't know how it doesn't create more of a whiplash effect because of the suddenness of it. I can see where some people would start to doubt chiropractors, chiropractic. One controversial story I will bring up, this was years ago now, but Dr. Ian, a Gonstead chiropractor from Australia, was adjusting a baby. I think the baby had colic, which is where just couldn't stop crying and uncomfortable, maybe gassy, but they're hard to soothe and console. And so the mom brought the baby in for chiropractic care from Dr. Ian. He adjusted the baby, and it was very loud adjustment on the video. And the result of it was the baby felt great. The mom was ecstatic by the results, but pediatricians in town in Australia didn't like it, thought it was dangerous or unsafe. Went after Dr. Ian. He eventually had to take all his videos off of YouTube and it sounds like had to go through a lot of legal fees that maybe bankrupted him or got close to bankrupting him. I don't know personally, but that's just what I've heard. And the unfortunate part about that is the results were phenomenal. The mom was happy, and all of his results that we saw on YouTube and what we know and what we hear were all great. So you took a great chiropractor, and unfortunately that had happened. So he was a Gonstead chiropractor, and Dr. Rahim out of California is a Gonstead trained chiropractor as well. Part of why I bring that up too is I have been a Gonstead trained chiropractor for 14 years, and that is a technique where most of the time we're going to get a full spine x-ray in our evaluation where we get the pelvis, the lower part where your hips come in. We get a picture of that. We get a picture all the way up to your upper neck, the vertebra called your atlas is the top vertebra in your neck. And then your skull, your brain sits in, is sitting right on top of that. It's a full spine assessment from the front of your spine and then a side profile of your spine. And that's where we'll see disc height, disc alignment, nerve holes, etc. on that side x-ray. On the front, we of course want to see upright posture, and we'll look for misalignments and measure pelvic stuff. Gonstead is one of the most precise, specific, and comprehensive evaluations in the chiropractic profession, especially for full spine. So ranging from, like I said, top of your spine atlas down to your foundation, which is your pelvis. And this is a technique that only a handful of people, I think in Minnesota, where I am, there's probably 30 some Gonstead trained chiropractors out of thousands and thousands in the state. And so there's only so many, a very small percentage do this technique. And so when you're going to a chiropractor, the overwhelming majority, I would say, are general chiropractors, just general techniques that they use, may not take x-rays, may just have you come in, ask you how you're doing, lay on the table, crunch, 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 and just start adjusting whatever kind of feels like might need adjustment. That would be a generic approach, kind of the McDonald's approach of chiropractic care. Now, when you get into Gonstead, or what another technique I love is Atlas orthogonal or NUCA. Atlas orthogonal is a surprisingly shocking treatment for the Atlas because they use this machine that they set up very specifically, but it's intended to puff some air on your Atlas to get a change. Now, I don't know, not been trained in Atlas orthogonal, but that's the gist of what I know. A puff of air is being used, not even a physical adjustment like traditional chiropractic care. NUCA, which is an upper cervical technique, they're focusing on the Atlas, which is the upper cervical of your spine, and they're looking at that very specifically, but the treatment itself is very light as well. I believe you don't even really hear any cracking when that is happening. Very gentle, but very specific. The foundational premise of that is that your brain and brain stem, which comes out at the top of your neck, is neurologically the most important part of your spine to make sure is healthy, make sure is aligned and moving properly, because when you have issues with alignment, issues with your nerves in your upper neck, you can cause all kinds of problems in your whole body. You have your vagus nerve, which is a primary nerve that comes out of your brainstem, goes down all the way into all your internal organs, and can affect pretty much every organ in your body. And you know, we all know sad stories of people being paralyzed. My best friend, he was paralyzed in a tragic sledding accident when I think he was 12 years old. He was sliding down the hill, and the front of the sled caught somehow into the hill, flung him forward, and his neck kind of caught back and bruised the upper part of his, I think it was C3 actually, of his spine. He was paralyzed quadriplegic from his arms and his legs, been in a wheelchair ever since. And we all know those sort of stories, or Superman, Christopher Reeves, who had a tragic fall off of a horse where you have an injury to your upper neck and you basically lose all function. Now, so we know neurologically the upper neck, the higher you get in the neck, the more effect you can have on the whole system, the organs, glands, muscles, everything. But we also know in chiropractic that, and if you just take a structural approach like an engineer would building a house, the foundation of that house structurally is the most important. And if that's not level or right, you're going to have problems above pretty much with everything you're building on top of that house if that foundation isn't right. And so foundationally in your spine speaking, of course you go all the way down to your feet, but when those feet go up through your hips, you're going to land at your pelvis. And that pelvis in your spine, your ilium, sacrum, sitting in the middle, if that's twisted and not right for whatever reason, the way you sit, the way you stand, as a baby, as you're learning to walk and you're taking the first few steps, like I have a son who is 1 year old, and I call it drunk walking. He looks like he's just staggering and falls on his butt real hard. Well, how many times can you fall on your butt that hard and not have something shift a little in your pelvis. Not very many. I guess kids are resilient and they can handle a lot of that, but their pelvis does shift. And so you want to make sure that, especially as you get older, you don't have pelvic issues that are causing other issues above. So basically, the foundation of your spine is your pelvis. And structurally speaking, that would be the most important part of your spine. Neurologically speaking, your atlas may be the most important part of your spine. So these are critical areas when you're getting evaluated for your spinal care, for chiropractic care. I believe it's important to go to someone who can equally look at the atlas and pelvis and treat and take care of those parts of your body as specific as possible. Going to someone who only checks one area or treats one area, I think is maybe lacking, and just my opinion, but I think you should consider going somewhere where it can take care of your whole spine. I wanted to dive a little deeper into the pediatric chiropractic, where some chiropractors only focus on adjusting kids as little as 1 hour old infants, 1 day old, 1 week old, up through the whole, one hour old infants for sure they would see. Now in my profession, in my career I should say, I've treated as, well, I have 3 kids, so I've checked and adjusted, very lightly adjusted my babies when they're 1 hour, 2 hour, 3 hours old. I've done it for patients, went to the hospital, don't tell the hospital, but went to the hospital and checked their babies for them. The idea behind that is that birth can be a traumatic experience. Obviously, it's a natural, beautiful experience. I've watched 3 children be birthed myself. I was traumatized a little bit just watching it and experience it. I don't know how women want to do it a second, third, or fourth time, but it is a beautiful experience to see a natural birth, baby coming through head first, and just a normal natural delivery with no pulling on the neck. But of course, sometimes when necessary, doctors may have to pull on the neck. They may have to, even in C-sections, kind of shimmy the baby out. Now, maybe nothing is even happening wrong per se. It's a normal amount for the doctor to be doing that, but it can be hard on the baby's neck, we'll say, or any other part of their spines. And so parents sometimes want to make sure that their babies are checked right away, just to make sure that they're starting their life beautifully with the spine not totally out of position, causing things like colic. The adjustment on a baby, especially a 1 hour old or a 1 week old, is as light as, I would say, touching the tip of your nose. It's you wouldn't want to push so hard that it would hurt, but you can kind of push on your nose and not have it be painful. It's really gentle. Or like a tomato. If you were to push on a tomato, you could push on it without breaking the skin of the tomato. If you're pushing so hard that it's plowing your finger through the tomato or cracking it, then that's probably too hard. The amount of pressure is so gentle. It's not any sort of aggressive thing like you see on YouTube where they're cracking, I don't know, almost cracking the crap out of people, hitting them so hard. That isn't anything near what a pediatric adjustment should be. And so it's an interesting profession we have. Chiropractic is a really beautiful profession, obviously with its quirks, probably kind of like a family. You got some Cousin Eddies in there. I hope this video and recording podcast is super helpful for you in learning more about the chiropractic profession, the different unique parts about it, the beautiful parts, the ugly parts, and everything in between. So I'll see you on the next show.